Professor David, is there I'm just curious. I mean, we now, at this point, we've had about 4 million people, Filipinos, inoculated. A little more than 1 million have had 2 doses. In the meantime, right now, notwithstanding the trends, everybody keeps saying the R naught is still somewhat manageable. We're not panicking because of that. I'm just curious, does the number of inoculated, let's say per million or in the millions, does that correlate to any effect on the reproduction rate?
Well, it would correlate, but right now the level of inoculation that we have had is still too low.
Small.
Right, too small to be considered significant in terms of having an effect on the reproduction. Yes, it will have an effect on the R naught, but as we can see right now, the R naught is actually already increasing in NCR. It's increased to 0.6.
Father, maybe you could jump in. But I ask obviously because, you know, as we reopen the economy, I imagine that's going to be one argument for it's okay. We can mitigate with the vaccination anyway. But given that the vaccination rate is right now, we're full vaccination. We're standing at just about a little more than 1% of the population. What's the response to that kind of an argument?
So the experience in many other countries suggests that we will not see a significant impact on transmission until the vaccination rate reaches about 30 to 40% in the population. And really you need higher than that in order to really mitigate the spread. So we're dealing with millions of people in the NCR alone, we're not even close to that yet. And keep in mind, so a lot of people are saying, well let's vaccinate now to prevent the surge. It takes 6 weeks, 8 weeks, depending upon which vaccine to allow for the development of immunity. So there's always going to be that, a month or 2 month lag in the effect of the vaccination on the pandemic. So, we've just heard that our supply will stabilize in June, and we're getting 2.2 million Pfizer on the 11th and more to come. So ideally, the numbers will start to increase. By July, we will have a stable supply, is what the national government is saying. So we will not see an effect for another month after that, and that really depends on who we inoculate and where we inoculate. So we will see.